Chondromalacia patella, also known as runner's knee, is a common injury in young athletic individuals and is one of the primary causes of chronic knee pain. What is chondromalacia? Chondromalacia is the wearing away of articular cartilage that sits between the patella and femur, protecting the bones from rubbing against each other. This tissue breakdown is gradual and comes in stages. Stage 1 is the initial softening of the cartilage. Stage 2 is when there is noticeable erosion of the tissue. Stage 3 is the thinning of cartilage and deterioration of tissue. Stage 4 is when the cartilage has completely deteriorated and there is bone-on-bone contact. This injury takes place on the patellofemoral joint. The patellofemoral joint consists of 3 bones, the femur, tibia, and patella. Articular cartilage lies underneath the patella, allowing for it to glide over the femoral grooves smoothly. This movement is necessary for knee function. Wearing away of this cartilage results in pain every time the patella grazes over the femoral groove. There are 2 main muscles involved in the stabilization of the patellofemoral joint. The VMO, which is on the medial side, which function is to keep the knee centered, and the IT band, which is on the lateral side, which helps to stabilize the knee. As the condition worsens, muscles such as the quadricep muscles, hamstring muscles, gluteus muscles can be damaged or strained. In young athletes, the most common cause of this injury is overuse. Constant pounding of the leg to the ground from activities such as running and jumping is the cause of the deterioration of articular cartilage in the patellofemoral joint. Not everyone who does intense activity involving running or repetitive jumping develops chondromalacia. The studies have shown that certain factors put you at higher risk for the condition. Some include poor alignment, such as patella alta, muscle imbalance, flat feet, and being female, with over 60% of the cases of chondromalacia patella being in female patients. Some symptoms of chondromalacia patella include patellofemoral pain, such as a dull aching sensation in the knee region and a feeling of grinding or cracking sensation in your knee. These symptoms often get worse after prolonged periods of sitting, standing, or activity. If a person has multiple of the symptoms just explained, it is recommended to go see a doctor. A doctor will perform a physical exam in order to determine the source of pain and the range of movement of the joint. If a person has a fairly good range of movement, the doctor may recommend rest from sportive activity for a few days, ice, and seeing a physio to eliminate any future pain. If the doctor is more concerned about the patient's pain and range of motion, they will send them for imaging, most likely an X-ray or an MRI, in order to get a better look at the situation inside of the knee. Once the stage of chondrosis is determined, the doctor determines the best course of treatment. Since chondromalacia patella is a chronic disease, whereas right now there is no permanent solution, there is not much that a doctor can do. But doctors and surgeons have come up with ways in order to help ease the pain of patients. One way is through arthroscopic surgery. In this surgery, doctors go in through a little camera and go clean up pieces of cartilage that are floating around the knee, causing pain. They also go in behind the knee and cut some ligaments in order to release tension in the joint. But because there is no current way for articular cartilage to grow back, if a person has stage 4 chondrosis where there is bone-to-bone contact, the only course of treatment is a knee replacement. Because there is no way a person can fully recover from this injury, there is no set recovery time. Recovering from arthroscopic surgery takes about 4 to 6 weeks for a person to be able to walk and do normal activities again. But both doctors and physios will recommend that a patient does not go back to their activity or sport to the full intensity. Physiotherapy is very important in helping to preserve the knee to avoid a knee replacement. Working with a physiotherapist can help eliminate any muscle imbalance to help avoid further deterioration of the cartilage. Strengthening of the quadriceps, hamstrings, adductors, and abductors is key for preservation of the knee. Exercises like swimming or riding a stationary bike are great because they are non-weight bearing. Isometric exercises are key in strengthening muscles to eliminate muscle imbalance. Some good ones include single leg raises, donkey kicks, and glute bridges. It is very important for patients to work with their physios and doctors to avoid further deterioration of cartilage. Some ways they can do this is do their exercises to avoid muscle imbalance, wear shoes to correct flat feet, be wary of activity with lots of strain on their knees, and wear a brace to help stabilize the knee. Research is being done all over the world in articular cartilage regrowth. Hopefully soon there will be a permanent solution for chondromalacia patella.